Hello, everyone. Today is our April 13th briefing. I appreciate you being with me. I want to say I really appreciate all those that on Easter Sunday were able to abide by our social distancing as much as possible and our stay-home order. And I feel certain that pretty much as a whole, we were able to worship and be respectful of, either the greatest or surely one of the greatest holidays, with Christmas or Easter being the other. But anyway, I appreciate all those doing that. I've got and this bothers me to my soul. Even though we're tracking well and everything, we now have 9 deaths in West Virginia. And Kathy and I pray every day, that some way, somehow this incline will stop. We know that probably that's not going to be the case because we are the highest risk state, and we've done amazingly well from the standpoint of all of you and what you've done as West Virginians. But still, it's just tough to think that we've lost 9 people. And for the most part, they've been elderly people, but nevertheless, they're still very dear loved ones to our families, and we just send our thoughts and prayers out to all. In addition to that, we just lost our 7th death was a 25-year-old from Logan County. From what I've been told, a young man that so many people just loved and thought the world of. And so, especially for him and his family, please keep them in your prayers as well. And we'll just keep fighting this battle as hard as we can possibly fight it. Believe me, B, I hate like crazy to make that report to you. Today, we're extending our executive order on the counties that were where we were having community cluster and hotspots to take in Jackson County as well. They had the highest increase in cases over the past 24 hours out of all of our 55 counties. So I feel like now we've absolutely got to bring Jackson County into that fold, and I believe that makes our total counties 12, I think, that are in that fold. We have payments to the TANF, and I'm going to mispronounce that, but it's temporary assistance for needy families. And I have instructed Bill Crouch to get these out immediately. It's a $500 payment to the current recipients, and it's also known as WV Works, as part of our ongoing response to this terrible virus. And so there's a bunch of people out there, needy people, this can help. And this is a one-time payment, but we're very, very hopeful that this will bridge some difficult times. Our workforce, West Virginia, has received now 120,000 claims since March the 1st. And we're working those claims as diligently as we can. We amped it up 3 times. We've amped it up another double of that, another 3 times. We're processing claims like crazy to make sure that everything gets out. We've sent 62,000 West Virginians have already received the extra $600 from the CARES Act, and this represented $37 million of extra unemployment benefits for those West Virginians. 17 members of the National Guard worked on Easter at our call center. I've got to announce to all of you that the Those of you that are self-employed or independent contractors, you are not able to file as of yet, but you will be able to do so soon. As soon as we get the rules and all the stuff, put together where you can file, we will announce, when that filing will be able to begin. But the one thing you've got to understand is all these benefits will be retroactive when available. And so we'll go back and capture all the dollars that are owed to you as soon as everything is available. The Constellium aluminum plant in Ravenswood reported that they have no new active cases of COVID-19, and the 7 employees that were previously tested positive have recovered. We send our best wishes out to their CEO, Buddy Stemple, and all the employees at the plant. I've got to remind you again about our census. It's all over the place. Be counted. For crying out loud, be counted. It's tremendously important to West Virginia. We've got to have everyone counted, or we're going to leave millions upon tens of millions of dollars on the table that's federal monies. I've got to commend our National Guard and all those that have stepped up, and I'll mention those in just one second. But, the National Guard's put together a mobile sanitizing trailer that is enabling us to sanitize the N95 mask. This method can sanitize N95 mask up to 20 times, and we are able to process 1,500 masks every 3 hours. In addition to that, we're making masks now in the state of West Virginia. We have a network that is working right now and has a capability of producing 2,500 masks per day, 75,000 masks per month. The West Virginia National Guard, in collaboration with researchers from West Virginia University and our colleges and community and technical colleges, have developed a solution to address a critical personal protection equipment shortage. And so they're doing great work there. I want to thank the many colleges and universities, the community, the technical colleges, the private companies, and the National Guard for the work they're doing. It's all really, really good stuff. Again, to be making our own masks, West Virginians always have a way of solving their own problems. And right here, we're doing it, right in front of our eyes. And so now, I guess with that, I've got one more thing, and then I want to conclude with a video that the National Guard has. But I want to make one more announcement, and that's this, that the U.S. Department of Transportation is suspending its situation on our food trucks at the federally funded rest areas. So from this point forward, the West Virginia Division of Highways has set guidelines allowing for food trucks at rest areas as a temporary measure to ease the burden on truck drivers, going through our state and trying to help with this pandemic in every way, that they can stop there and get a sandwich or get something to eat and everything and go on their way. So I think we've got to be careful, no question with that, but at the same time, it's, this is in response to a suspending that was done by the United States Department of Transportation. Now, last thing I have before the video is just this. I just got off a conference call with the Vice President. We have an immediate need in our state right now for gowns and surgical and gloves. And so with that, everything else we're pretty good shape on and everything. I asked them to really step up and do that. The response was very well, from our Vice President and his team. And I also asked that they give us the extension to be able to extend our National Guard and the funding of our National Guard, and to extend that to 500 guardsmen for 60 days. I think that'll come very, very, quickly. And so the Vice President was optimistic about what was going on, but and I stay if you look at our dashboard and this, it just goes up, and you'll see it again in just a minute. What you'll see is just this, that in the last 3 days, we have been on a positive test per test taken of 2% on the 11th, to 5% on the 12th, to 4% on the 13th. We're now averaging 3.76% positive to the number of tests taken. We are now above the national average on testing from 97.4, the national average being 85.5. I take that back. We're at 93.7 versus 85.5 on a national basis. We're ahead of every state except Pennsylvania, and they're at 97.4, and we're at 93.7. So for all practical purposes, all that's good. The only thing that's not good is just this, and I keep saying it over and over, and it just makes me sick, to tell you the truth. I just hate it to my soul, but we've got 9 too many deaths in West Virginia, and we're going to stay after it in every way, shape, form, or fashion to try to minimize that impact in every way. And we appreciate all you're doing out there, all the West Virginians and all the healthcare community, the heroes beyond heroes, whether it be first responders or whoever it may be, or Guard, and on and on. So anyway, God bless everybody, and I'll go now to that video with the National Guard.
What we've continued to look at with the guidance of General Hoyer is that we need to get ahead of the PPE shortage that we're going to see throughout the state of West Virginia, as well as what we're seeing across the nation. So currently we're seeing a huge shortfall in N95 masks as well as surgical masks. The FDA has come out with a sanitation process that we can sanitize the N95 mask using a hydrogen peroxide vapor solution. So as we continue to utilize this and utilize the hospitals across the entire state of West Virginia, that's going to help us during our shortfall of the N95 masks. With that, we continue to grow redundancy in the 3D masks, which is an equivalent to an N95 mask, as well as creating a surgical mask that we've came up with working with WVU of a Gore-Tex material as well as a cotton material that we're going to start producing with our rigger shops and our air wings throughout the state of West Virginia.
We became aware, as did everyone else in the state, that there wasn't enough PPE at our hospitals. Our colleges have been lucky enough and have been blessed enough that we have this incredible equipment, and we also have this incredibly talented staff and faculty who have great ideas. So we did have a faculty member at Pierpont Community and Technical College who came up with a prototype that was then tested by WVU Medicine with the help of the National Guard, that has really proven to be incredibly successful. And with partnership with the Guard, we're going to be able to start producing those masks all over the state of West Virginia.
The heart of RCBI's mission, we are to support manufacturers and innovators. So when the National Guard put out the call for assistance, we immediately put our experts and our equipment to work prototyping and producing PPE for frontline workers. The team at RCBI is really proud to be part of this effort and proud to be partnering with the National Guard in trying to provide protection for our healthcare workers, first responders, and all those who are facing this pandemic on the front lines.
All right, now let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Today we have 598 members of the Guard on duty. So far we've completed 353 missions. As the governor pointed out, a number of organizations are stepping up to address his call for innovation to try to address our challenges that we have as we face this threat. A couple other folks and organizations I want to point out who've really stepped up. Dr. D'Antoni and the folks in the CTE program and Department of Education and across our school systems, and Dr. Suzanne Strait and the folks who is from Marshall University, but the folks that she established under the name the Mask Army has stepped up across the state of West Virginia to help produce needed PPE for those on the front lines. In addition, in the future, you'll see us begin to work on things such as production of swabs, as well as production of parts for ventilators going forward as we work through this challenge. Also want to point out that private organizations and hospitals like CAMC and Mountain Health have stepped up to use their machines to be able to sanitize PPE. And just an example why this is so important, at CAMC, they'd have the capacity to decontaminate or sanitize up to 4,300 masks a day. If each of those masks can be used 20 times, that's the equivalent of having 86,000 N95 masks. So it's really important for us to look at the governor's call to innovation as we address the challenges going forward. In addition, as the governor pointed out, we continue to work with our partners at Workforce and continue to praise the employees at Workforce for the great work that they're doing. Over the weekend, the call center did remain open. In addition, 30 personnel last week were trained to actually process claims. And today, 28 additional personnel are being trained, as well as additional personnel are coming on to support the call center. There's a call going on right now with a couple of private entities to look at beta tests on technology that we'll know in the near future of its capability to help improve our efficiency and effectiveness in taking care of our citizens and them receiving the claims in a timely manner. In addition, today, 100 personnel were tested at West Virginia University, staff and students related to a potential circumstance in the dorm facility at WVU. National Guard personnel helped the Monongalia County Health Department with the testing at that location. Over this weekend, 4,000 meals were delivered to multiple boards of education to support the feeding of our children. We do have some counties on spring break this week, and we're continuing to work and monitor what is needed for those students and addressing challenges for feeding those students during spring break. As of this past weekend, during this past weekend, 1,571 food boxes were prepared at Gasaway, as well as additional food boxes at the food bank in Huntington. So again, a lot of great work, a lot of people answering the call that the governor and his team have put out for innovation, for hard work. On behalf of all the guardsmen, I want to thank all the citizens of West Virginia who continue to work hard and listen and heed the calls for us to do the things we need to do to break this curve and get our state moving forward. Thank you.
Thank you, General. Up next, let's go to Dr. Clay Marsh, our coronavirus czar.
Well, it's a pleasure to be with everybody today, and I wanted to make a few comments that have come up through varying sources. So, some people are asking if we've passed the peak on the University of Washington model of our demand for our state. Why don't we start to relieve some of the restraints and get back out? And first of all, these kind of models, the University of Washington is one, but there's many of them, are really dynamic prediction models that rely on the information that is going into them every single day. And as we've said before, that these are not just static one day and time predictions, they are dynamic. And so, our state and you out there have been doing an amazing job, and we're so grateful for that. But we need to understand that by doing our social distancing and physical distancing and staying at home and protecting ourselves, we're really giving ourselves more time. Certainly, we know that there's people in our community that have tested positive. We can see that on the DHHR website. We also know that as we expand testing, we will find additional people that are positive. But it's really important that if you even look at that model supposes that we stay physically distanced and at home till the end of May. And as the governor said, we are starting to see some more people that are dying of COVID-19. And so as we have a vulnerable population, and as we have a majority of our people that have not been infected yet with COVID-19, then we need to pay additional and consistent attention to the fact that we can't let our guard down. And we're doing a great job. As the governor said, we have tested as much as the average American state, and for some more. We have seen our case fatality rate go up slightly, and that is concerning to us. The U.S. average now is approaching 4%. And we look around the world average is approaching 6%. And as we look at countries like Sweden that are trying to help their population get infected and try to get them to recover to get what's called herd immunity, their mortality rate's up around 8%. So we know in order to save lives and to help people, we have to continue to do exactly what we are doing now. And the two pieces of information for people that are asking, when may it be the right time from a health perspective for us to start to repatriate, to try to release some of the restrictions? And the advisement is that we would like to see the number of positive cases go down for 14 days consistently. And that's a reason, and the reason 14 days is because we know when you start to do these types of strategies around physical distancing and staying at home, the maximum benefit comes between 8 and 14 days. And so you want to see a whole cycle of that. And then we've talked about this measure of viral infectivity called the R0 or R sub-0. And you'd like to see that at 1 or below, which then suggests that a person infected can only infect a single other person or not even that, which reduces that rate of spread. And certainly we still have capacity and we're planning still for what could come. And many experts are starting to think now as we start to get through this first phase, and certainly not everybody is through the first phase, and we need to be, still highly vigilant in what we're doing, that the second phase is going to be perhaps even trickier. And when we look at Asia that's starting to repatriate, we know now that countries like Tokyo, like Hong Kong, like Singapore, like South Korea are starting to see some additional problems. And as we approach this, we're going to have to approach this carefully. And of course, the governor will decide how we go and what the right steps are for the state of West Virginia. But we know that it's really important that we stay together, we stay cooperative, we stay connected on this. And ultimately, if we do things correctly, then I am very optimistic that we'll get back out again in the near future, and we'll get back out safely again. And as we do that, we're trying to augment our ability to test, both in the tests that we do today with the nose swabs for the virus, and also test to see who might be immune from already having the virus and recovering. It's important to note that at the same time we're buying more time and saving lives and helping our citizens, that there are really rapid advances that are being made. There is a drug by Gilead called remdesivir, and it is a drug that inhibits a particular part of the viral's replication. And this is not a controlled study, and that needs to be done. But it looked like that a group of people in the intensive care unit on a ventilator benefited from getting this drug, and a overwhelming percent of people, about 68% of people, were able to get out of the ICU and eventually leave the hospital. So that is a very promising start. Drug or vaccine trials are going on very quickly, and certainly we know that vaccines could be a more final solution to this. And I think that for me, as I'll end my comments, these models like the University of Washington model are important to see what we're doing and see if these models are responding in the way that would say that what we're doing is working. And we look at our own statistics and look at our own modeling. But it's clear that we write the story of our future in West Virginia every day by what we do and how we respond and what personal responsibilities we have. General Hoyer talked about all the innovations, and we'll have even more to announce in the near future. And I think that we have a wonderful team. We have an amazing state, an amazing populace, but we are still very vulnerable. And we know now from New York City that things that predict hospitalizations are older people, 65 to 75, and then over 75, people that are more overweight, people that have heart problems, people that have lung problems. And so that is part of what our population has as well. And so I continue to thank you and to implore you to stay with us and stay strong and stay together and stay physically distanced and do the things you're doing now, staying in your home when you can, and also making sure that you wash your hands and avoid your face. And so far, so good, West Virginia. Thank you.
All right, thanks, Dr. Marsh. Next, let's go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slim.
Good afternoon, everyone. Just a couple of quick things. We've had a couple of questions with regard to our state facilities. DHHR operates 4 long-term care facilities in the state, 2 psychiatric hospitals in the state, and 1 acute care hospital in Welch, West Virginia. So we've had questions regarding whether or not these facilities follow CMS guidelines and CDC guidelines, and the answer is yes. We clearly follow all of those recommendations from both entities. CDC is the one who's releasing guidelines that are aimed at protecting our employees so that they can protect our patients from this virus. So we are following those carefully. We're going back and again reviewing what is done and doing sampling with regard to folks who are taking temperatures, making sure that's done properly. We want to keep our employees safe, and we will do that to the best of our ability. And just to elaborate on what the governor said, thank you for that announcement, Governor. This is a payment, a one-time payment of $500 for TANF recipients. TANF for West Virginia Works. The payment will provide low-income families an additional $500 for additional financial help and may be used to supplement monthly living expenses or other needs of the family. The one-time payment will not count against other DHHR benefits. This is independent of those. Payment will be issued to families who were active in West Virginia Works in March of 2020 and eligible to continue participation in April 2020. We will begin processing those payments immediately, so that will be done as quickly as possible. So thank you all.
And I'll provide a few updates here as well. First, I think when you look at the website and you see that there are 626 confirmed cases, I think I really have to do a shout out to our public health system. You know, that is an unprecedented number of case investigations that's underway and going on. So they really, every one of those investigations has been looked at and is being investigated, contacts identified, management of those contacts, outbreaks being investigated. It is more than I think we've ever dealt with at one time across a system. And so we really have to say thank you and a shout out to all of the folks at state and local levels and to our partners, from volunteers to medical students to National Guard and others who are assisting with that. So it's not even just the investigations around those 626 cases. It's also with the context of each of those cases, management in terms of following them while they're in quarantine or been asked if they've been exposed, making sure that they are not developing symptoms and that we get linked to the right care if they do. There's a host of work going on there. So I just think it's really important to look at the magnitude of that and what's underway and the work that they do every day to help protect communities and to help make sure that individuals with COVID-19 are into care as they need to. The second area that I wanted to reference, and we've had some questions around, has been the area of environmental contamination, sort of the potential for picking this virus up off of a surface and then introducing it into your body through putting your hands in your mouth or your nose, those kind of ways that we could potentially introduce the virus. And I think it's important to think about the fact and to just kind of put it in context that we never have and do not now live in a germ-free world. And we now have introduced another novel virus, it's a different virus, into that mix. And it's one to which we are all very attuned to. But some of the same ways that we try to prevent contamination and that infection every day apply here just as well. So what do we know about the virus? We do know that it probably is predominantly spread by respiratory droplets and that respiratory spread aspect of things. And so that is just the absolute importance of that physical distancing, that staying home if you are sick, that whole management of how we handle individuals who are exposed. That is the key thing from the respiratory spread aspect of things. We do know that the virus can live on surfaces like other viruses. It can live on surfaces for up to probably a few days. It really varies with the surface that it's on. As well, it varies with probably the temperature and the humidity and the surface that it's residing on. But it's possible to be there. The risk of transfer that way is probably lower than respiratory spread, but it is possible. And so there are, I think that reiterates the importance of the measures that we talk about in terms of good hand washing. So we've had questions around, can you get it from touching food or packaging exposed to the virus? And so while it's probably pretty low based on current research from that, if you want to wipe those down, you certainly can. What's really most important there is good hand washing, cleaning your fruits and vegetables, and cooking to the appropriate temperature like you would any day in handling food safely. And so again, it's that hand washing, it is that washing your fruits and vegetables, it is that cooking appropriately, following the guidelines for how that product needs to be cooked. We do know that the virus is heat sensitive. We get questions around handling money and payment options, and again, certainly that's it's possible to reside on that for a short time period. Again, it's all about hand washing and sanitizing your hands. Some people are preferring to use electronic payment methods such as ordering and paying through apps like PayPal, which eliminates some of that contact. Others are wanting to kind of wipe down their credit cards or those kinds of things. But again, the key principle there is good hand washing and hand sanitizer. That's what actually, even if you do get it on your hands, avoids getting it into your body. So again, it's that hand washing and that not, especially before you eat or anytime that you would touch your face or mouth with those kinds of things. I think the other situation that we want to reiterate, we have been saying that, as you know, the key measures have been, besides the physical distancing that we're doing and the hand washing, environmental cleaning and hygiene areas, we've now added an adjunct, which is some cloth masks or other masks. And that does not replace the other activities. Absolutely. It is in addition to those. It is important that when you are taking off your mask, that you also wash your hands before and after with that, and that you don't, if there were something on that mask, that you're not getting it on your hands and then putting it in your mouth again. So that's important. So again, I think the measures that we've been saying and talking about are the ones that you all have been implementing and doing a great job with that. And that's making a big difference for spread in our state. Last area, there are some new resources on the Coronavirus.wv.gov webpage. They include some guidance for municipal and medical facilities, solid waste disposal. So that's the entities that take care of our household and business waste, as well as our medical waste. There is guidance for homeless service providers, which can help talk about and support our systems of care for our homeless. There's a critical population to make sure we have services available for, and ways to address that in shelters and housing services. And then finally, there's some guidance for community and faith-based organizations, which again speak to ways that our faith-based organizations can both continue to be the faith-based organizations they are, but to use alternative approaches that maintain the appropriate prevention measures in place. So I will stop there and turn it back to the governor.
All right, thank you both. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is David Beard with the Dominion Post. David, are you with us?
Sorry, I forgot to unmute my mic. All right, can you hear me okay?
Yes, we can.
Okay, thanks. Dr. Marsh had addressed my chief question, which is when can we start looking to ease some of these restrictions, but you also mentioned that some of these Asian countries in phase 2 are experiencing some new problems, and I wonder if you could elaborate on that.
Governor, okay for me to take it?
Yeah, no, go ahead.
Okay, so David, I think that there are 2 or 3 sort of issues that many of these Asian countries are experiencing. So one issue is that they are finding people that got stuck overseas coming back home. And so as they're seeing parts of their population coming back into their countries, that is starting to activate some clusters of disease. The second issue is they have opened back up again to some tourism, and people coming from outside into their country has opened up issues. And number 3, that they're seeing that there are clusters within their own communities as they've brought people back out again. And as we go forward, I think what we know about this virus is that this virus is heavily communicable, that it is spread by people that are asymptomatic. And so as we come back out and as we see what's going on in Asia, I think it's really going to make us be very committed to broad testing and really good surveillance. And that's what Dr. Slump does really well with our county health officers. And that's going to be a key, because in Germany, they are doing that extensively, even going door to door to make a big difference. So on the next stage, we're going to have to pay a lot of attention. We're going to have to do a lot of testing. We're going to have to follow up a lot of people. And when we see things that kind of may heat up again, we may have to kind of take a step backwards and forwards, until we get the effective drugs that we are all waiting for and get a vaccine.
Okay, thank you, David. Up next, let's go to Annie Moore with WVVA.
My question is, are we doing any of the antibody testing in West Virginia? And if so, if not, is there any effort underway to secure those types of tests?
Okay, I think Kathy, you're going to have to answer that, but because I didn't hear the exact question, to tell you the truth.
Sure. There are a couple of different types of testing that are evolving, and this is natural in terms of as we've got new viruses and we're finding new test methodologies. There's a ton of companies that are evolving these methodologies. So the primary one that has been the standard test methodology has been something called PCR, or polymerase chain reaction testing, and that actually detects the viral RNA of the virus. And so that has been sort of the gold standard and the testing that we have at this point that we are utilizing most broadly in the state. So we use in the state lab and other places. There also are methodologies to test related to serologic testing, which you asked about. And what those are is they are detecting our body's reaction to the virus. So have we developed antibodies to the virus that suggest that it might be that we've had the virus, and potentially it can sometimes show, is it a current infection or a past infection based on the type of antibody that you pick up. That testing is still evolving. There are some tests that are out there and that are available. They can be of benefit. They also have some limitations because there still is some cross-reactivity with regular coronaviruses and some not quite as specific as we'd like it to be. But they can be useful. They do have limitations. I think over time we will be seeing even stronger serologic testing opportunities, and that those will be available on the market more in the months to come, weeks to months to come, we hope. They will be very helpful, I think, as we kind of move into a next phase after this first wave, to better understand how many folks in our population have been exposed to the virus and had infection who may have never realized they had it, since we know that we can have asymptomatic individuals who never knew they had the disease or had very mild disease. And so those will be very helpful in the future.
All right, thank you, Annie. Up next, let's go to Aaron Beck with the Register Herald.
Aaron Beck, Register Herald. Can you hear me?
Yes, we can.
Okay, West Virginia has seen a decrease in child abuse referrals, likely due to school closures, fewer doctor visits, and social isolation in general. I've heard you all encourage neighbors and loved ones to continue making child abuse referrals during this time and keep an eye out for each other. But I was wondering what specifically DHHR is doing to protect these children.
Let me just touch on it, Aaron. It's a real concern of ours, and Bill Crouch, you can elaborate on it, but you got all these kids home and they're out of school, and the school, in all honesty, has been a safe haven to a lot of these kids. So Bill, if you could follow up on that.
Absolutely, Governor. Hi, Aaron. Thank you for the question. If you've followed these, I try to bring that issue up 2 or 3 times a week. It's very important. It's a concern that we all have. Our Bureau of Children and Families is working with the community providers throughout the state to try to make sure everyone is on their toes, and we announce the numbers frequently, and we follow up. And that's more difficult, clearly, in a situation where we're in order to stay at home. So, and essential workers are still out there, however, doing all of those follow-ups either by phone initially or in person. If we have a situation where we believe there is abuse of a child or a vulnerable adult, our folks will go out. We provided them masks. We want them to be safe, but there are times when, as essential providers, we must go to someone's home and follow up on a case. And we still have the same system in place we've always had in terms of referral of those children. And if we need to remove a child from the home, we're still doing that and making sure the child is safe. Our emergency shelters are still functional, and our foster parents, again, are doing a terrific job out there. So the system's still in place, and I try to make sure and worked on that some this morning to make sure all of our services under these extraordinary circumstances, that those services continue, and all of our citizens who need our services can still get those services. So, but thank you for the question. Again, I'd like to bring that up every time we can.
Okay, thank you. Up next, let's go to Kara Lofton with West Virginia Public Broadcasting.
Yeah, this is Kara Lofton from West Virginia Public Broadcasting, and my question is kind of related. So, one of the things that I've heard is that there have been a decrease in referrals, but there's actually been an increase in foster families getting certified, and that they're using sort of Zoom and other technologies to do that. I mean, is there a movement, or is there discussions about making that permanent so that that families who are trying to be certified as foster parents can do that a little bit more easily, considering sort of how many kids are in the system right now?
Let me just start off, and then Bill, you've got to follow up again. But from the standpoint of being able to go to our virtual online, from the standpoint of becoming a foster parent, we've really pushed that. We've encouraged that in every way. Just like anything and everything, there's miscommunications. There's people that believe, well, you can't do anything in regard, even though they may want to become a foster parent. We can't really do anything in regard to that. We've surely got, a shortfall of foster parents right now, and lots and lots of kids out there that need your help. And I could go on, but the net of the whole thing is we got to have people step up, and they are, but we've got to have them step up even more. And Bill, you can go from there.
Thank you, Governor. And I want to thank the governor because he's been a champion for our children in this state since I started this position. In terms of the number of foster parents, I will get back to you with that information. I don't have that right now. It is more difficult to do everything we do. We clearly benefit from that face-to-face and those personal communications. We're learning better, I think, to do video conferencing and do things from a distance. But we can't let that become a barrier to getting the foster parents we need and the families we need to take care of our children. So I'm happy to get that information. I think it's an excellent question, and I'll come back to you tomorrow with some answers on that. Thank you.
All right, Governor, back to you.
Well, let me try to summarize. And, first and foremost, everyone's got to understand that we're dealing with something, and we're dealing with something here that none of us have ever seen before. We know it's an all-out pandemic. I hope to goodness that all those that were watching, just didn't drop off when I got through talking, or maybe some of the questions that came in, Dr. Marsh or whomever, whether it be Kathy or Bill when they were talking. I hope everyone's still there, because I really want you to hear all the words that I have to say. There's so many different people that are doing so many different tasks, and they need to be commended in every way. If you just think just what our general with our National Guard, General Hoyer, said earlier, he said just in the last little nowhere, time period, they have done an incredible amount of food boxes. They've done an incredible amount of meals. They've worked in a dormitory at WVU. They've worked at nursing homes and hospitals, and on and on. It's unbelievable the work that they're doing, and I appreciate them more than you'll ever know. I want everyone out there to know just this too. I was doing a little bit of math, and I was just scribbling around on my little paper as I was sitting up here while others were talking. Can you just imagine that we've lost 9 people in the state of West Virginia, and I hate that so bad, and my prayers and my heart just pours out to all those and their families. But we've got to realize too that West Virginia is the highest risk state in the nation, and it's sitting within a rock's throw of 2/3 of the population of the nation. And the amount of our bordering states all around us that are having, catastrophic problems, there is so much good work that you've done, you as West Virginians have done. And I couldn't be more proud of the fact that just things just like this, if you take today the total number of deaths, and I'm a numbers guy, I surely understand that we're not the most highest populated state in the country, and I understand that New York in itself may be 4 or 5 or 6 times as big as West Virginia. But I would tell you just this. In this nation today, we've lost in excess of 22,000 people. If you were to divide that by 50, it would be 440 persons per state. West Virginia, we've lost 9. Something is really working here, and it's working because of you, our people. You are doing great, great, great work. The number of deaths in our state compared to other states is unbelievable. The national average is around 4%. We're at like 1.4%. The international average is in excess of 6%, but it can still get bad. And so I would just ask you to please, please stay the course. From the standpoint of things getting better, if I'm doing it correctly on the sheet that I have, that really you don't have or haven't seen up there, but on the sheet that I have, we went through the dates of April the 7th, the 8th, the 9th, and the 10th, with the number of positives reported at 67, 50, 74, and 41. And since that time, we've dropped off. And that's what we want to see. We want to see it continue to drop off. But from the 7th, 8th, and 9th, and 10th, we were much higher than where we dropped off. And my sheet shows we dropped to 16 and 33, and then it's incomplete for today. But that curve is the curve we're looking for to be able to look at the possibility of backing things off and going forward. We're not there yet. There's massive testing that's going to happen, throughout all of our land. There's a vaccine that's on the way at some point in time. We're not where we need to be yet, but we're getting there. And we're getting there because of the great work that each and every one of you has done. I can't say enough about our heroes from healthcare, our first responders, and on, and I thank them, and you should thank them every opportunity that you get. The last thing I want to tell you is just this. From an economic standpoint, work the stimulus stuff. Every last one of you work the stimulus stuff. There's real live dollars, and they're out there for your taking right now. Work it in every way you possibly can. Use every agency, use us, use every agency to try to help you in every way you can. The self-employed and the independent contractors is coming. We don't have that yet. You'll be made whole, but we don't have that yet. And the other thing I'd like to tell you is just this. If you qualified through the Small Business Administration for a loan that is forgivable by you paying your payroll or whatever it may be, your insurances or payroll taxes or whatever, don't just shut down there. Go look in the other sections, because just because you qualified on the left hand, it doesn't mean that you can't qualify for additional aid on the right hand. So absolutely just remember what I'm telling you. Work the stimulus stuff as best you can, because every dollar that you have coming into your business or your entity or to you as an individual, for every dollar that you have coming in, it will help you and it helps our state. And so the only thing I would end it with is just saying just this. We hate, and please keep those 9 in your thoughts and your prayers, and let's pray to God above. We don't have another one, but the odds are much, much against that happening. And as we go, remember that West Virginia, you are absolutely doing great, great stuff. You know, you have a rate of 1.3 or 1.4 compared to a national average of 4, and you just got to stay that course, and we'll get through this. And it is amazing to think that you're at 1.4 and the nation is at 4, and absolutely you are the highest risk state of all. So stay the course, West Virginia. You're doing great. I'm very proud of you. Thank you so much.